And no more blowing in the microphone.
Okay. Good afternoon.
Hi.
Thank you, Patrick. Welcome, everybody, to our April Parkinson's Awareness Month telehealth. Thank you very much for joining us. I'm Cindy from the Parkinson's Resource Center, if you don't recognize me. I just want to thank you all for coming and attending, and I would like to thank our panelists today, too. I will introduce them in just a moment. April Parkinson's Awareness Month. There's a lot of things going on in Spokane and hopefully around in all the areas that we're at. And I just want to go over a couple of them real quick. We have, well, actually, I'm only going to go over one. We have something coming up on April 19th called Freeze for Parkinson's. And freezing is one of those, or rigidity, or something like that has to deal with Parkinson's. So we are all gathering in Spokane. If you can make it from Alaska, we'd love to have you here. To stop for 2 minutes for Parkinson's at the River Park Square atrium. And then afterwards, our Tremble Clef Spokane singing group is going to do a couple songs. We're going to sing along, and then we're going to disperse. So it's kind of like a flash mob, only we're going to stand and stop. And we're going to try and raise awareness for Parkinson's. And I just want to let you know about that. If you can't come, if you know somebody who's in the area, it's 15 minutes to show your support for Parkinson's. And afterwards, if you have questions about other activities, let me know. I want to thank Northwest Parkinson's Foundation and St. Luke's and Northwest Telehealth for their ongoing support and partnership, and grants provided by Empire Health Foundation, Teva Neurosciences, and Medtronic that help keep this program going every month. And all the support that we get from all of our contributors and Parkinson's patients and everybody affected by Parkinson's disease. Today we're having a panel, and forgive me, this is my first time doing this panel. So I told them, you get to come and talk for 5, 10, 15 minutes about what you know and your experiences with Parkinson's, and then at the end, we'll go around like we do to every site. And if you'll hold your questions till the end of all of our speakers, then we'll open it up at the different sites as we do our check-in for how many people and questions, and you can grill them all at that time, actually. But I'd like to thank Brian Gates, pharmacy, WSU pharmacy program. I'm still saying it wrong. I'm sorry. You'll have to do it better. And then Jer Sewell. And Jer was diagnosed at 31 with young onset Parkinson's disease. And Patrick and Julie Willis are here, and they're our coordinators for our Women with PD support and social group. And they're going to each have, again, about 5, 10 minutes where they're going to talk about their experiences. And then if you'll hold your questions until the end, we'll open it up to questions and go from there.
Am I on? Sounds like I am. Well, as Cindy mentioned, I'm Brian Gates with the WSU College of Pharmacy. And also, I spend a lot of my time with can you still hear me? Is that cutting in and out? Okay. I spend a lot of my time out in the field, and I mostly train students while they're on the job, and a lot of that's with the Providence visiting nurses. And so we actually get the chance to go into people's homes and help them with medications. And so a lot of my experience is actually working with someone who has Parkinson's in their home and trying to help them with medications from that standpoint. And as I was asked to say, what would I say as a pharmacist to tell people about medications? It feels like that's cutting in and out on me. Is that still okay? I'm too close. Right there. Find that sweet spot? Okay, good. But as a pharmacist, one thing I would really tell people is to really realize, as I know you know, that everyone can be a lot different with some of their symptoms and even how medications affect them. And so working with Parkinson's and the medications very much becomes an art. And it's also very important then to keep communication with providers and let them know what's happening. And that can even be, from my end as a pharmacist, even asking your pharmacist questions and letting them know what's happening. And then also, of course, communicating with physicians or nurse practitioners, physician assistants who you may be working with, and being sure to let them know what's happening. And one thing that includes is being sure you've got your medication list updated. And you may have heard us emphasizing that before, but we run into a lot of times when we're asked to go into a home and help people answer questions. And sometimes when we go there, the list that we have before going out is completely different than what somebody's actually taking. And so sometimes even just having that list not accurate gives us an entirely different picture before we're going out. And so that can be very important, because sometimes, especially in some appointments, physicians may have a limited amount of time talking to you. And so if they're looking at the list and making some assumptions there and you're not telling them, that can make a huge difference in terms of what they're doing to adjust your medications. And sometimes it may not be accurate at that point. And then even from side effects as well, I'll have some people ask me, they said, well, I'm taking these meds, what side effects should I expect? And one of the first questions I'll ask, especially when they've been on them for a while, is what side effects are you experiencing? Because as you may know, I want to know if they've had any trouble with it or not. Some people will even tell me, well, I read on the internet that this could happen with a medication. And so my first question will be, well, have you experienced that? You've been taking this for 2 years. It's probably not going to suddenly start unless it's something, in some rare cases, it's something that's more toxic from a medication. And so I think that's always very important as well. Just being able to tell someone what your experience has been, what have you seen, because, again, everybody's very different. And I think that's something we often forget, is that somebody will say, again, it could be the internet, or they're talking with even someone else who said, well, gee, I shouldn't be on this med, I should be on this one instead. But because everyone's different, that can vary substantially with what you need and what somebody else may need. Going back briefly to general things about side effects, another tough thing is just tolerability then also. Some people are highly sensitive to the medications, and maybe just a very small dose will cause a lot of problems, and other people can really tolerate some of the medications. And so we really have to try to fine-tune that in some cases. And that goes back to where some people may be on one medication, some people be on another, depending on what they can tolerate and as their symptoms as well. And so always keep that in mind, because I've had times when somebody even would tell someone, well, gee, you're on a really low dose of that medication. That's probably not going to do anything for you. And when they ask me that, I'll say, well, why are you on that low dose? Did you have side effects, and how did you respond to that? Because if someone is highly sensitive, they might need a very low dose and do very well. Somebody else might need a much higher dose, and that will make a big difference for them. I'm actually a little short. I guess that'll leave us a little time for questions, because I know, at least from the medication standpoint, there could be a lot. But I think that's my biggest message. If you're keeping a medication list, keeping that communication, and keeping in mind that everything that you do is a little bit different than what somebody else might have, and keeping that history and letting other healthcare professionals know that before you're making your own adjustments. I think that's probably one of the most important messages I could get across, and hopefully that'll leave us plenty of time for questions too.
Well, I'm Jeremy Sewell. I'm a contractor and 4 kids at home. Luckily, my wife is a pharmacy tech, so she knows my drugs. I don't have to do anything. Anyways, I was diagnosed at 31. I just started with a arm shake, and it was a real stressful time. We had one house being built and starting another one, and there was only 3 of us. And one day my chest was jumping, and I laughed. I told the lady, I said, we don't need the concrete vibrator. I said, I just grabbed the forms. I said, and we'll shake that concrete right out, And it really freaked people out. I just wanted to get the job done and then go to the doctor, but they took me up right away. I had MRIs and this and that, and finally got diagnosed. I went to Dr. Britt here in Spokane, told him, well, I like you, you're a good man, but I don't like your diagnosis, let's go somewhere else. So off to Seattle we went, saw Dr. Giroux, nice lady. She thought it was crazy, so I had to go and take a crazy test. Turns out I'm not crazy, I'm brilliant. And she diagnosed the same thing, and so then it was sit down and figure out what do we do now. And I've tried more meds. You know, he was talking about meds, and that is it took me 2 years to finally find something that worked. You know, and I finally found that Requip XL. I can tolerate that better. I don't get sick. I was getting where I would throw up taking the Ropinirole, and luckily I haven't got into any of that hard stuff yet. So I've been staying away from all that. They've tried to push it on me now, but I take that. I've been in a new pro study, but as a contractor, we were roofing at the time, and that's one that you ingest through your skin. And when I would sweat, I'd ingest too much, get low blood pressure, and then pass out. So, you know, being up on a roof and passing out, that's
not a good idea.
That's a bad call, cornflake. So, so we got off of that one, but I still keep a lot of them just in case. And I've actually found that exercise has been the number one thing for me. I know I don't look like I do exercise much, but I do exercise, and I eat a lot of cheeseburgers, which is a bad thing. But I did a Tough Mudder, which some of you know, last year, which is a 12-mile running obstacle course, and it was pretty brutal. But the more I trained, the less my medication, you know, that I had to take, and I've even found I had to start bumping it up since I quit training after, and within a week of starting to train again, I started getting sick from my meds again. So I started dropping my dosage, and there's some days where I just don't take anything, and I do fine. You know, if I do that for too long, it catches up. But you know, it's just, I guess in my mind, it's just one of those things. It is what it is. It's always evolving, and I'm always messing with my medications. You know, I take Azilect, which I think has been a wonderful drug for me. The Requip XL, I actually dropped it to 2 milligrams, which is the smallest dose, and low dose naltrexone, which a lot of people don't use for PD. It's more of an MS experimental. But I know since I've started taking it, I haven't had the flu, haven't had a cold. So that's been wonderful. It's supposed to boost your immune system. I said, I wish my wife was here. She could name my meds for me. Oh, yeah. And my mother-in-law was going to massage school at the time when this first started. And it was really bad when I was shaking really hard. I'd get stressed out just from everything, you know, and screaming children, and my stomach contractions were like at 120 a minute, you know. And I remember my son asking me, he says, "Dad, why are you dancing?" I said, "I just love the music in my head, boy." You know, but I was just shaking so hard and couldn't control it. It was exhausting, and massage was the only thing that would stop it within 5 minutes. And so now I go once every 2 weeks. And there were times where I was going 3 times a day because she lived right up the road. Call her, say it's bad. She'd say, "Come on up." But that's been wonderful. Chiropractor, I go to because I have a lot of muscle pain, you know, and a lot of rigid muscle, and it will pull stuff out of whack, and my neck gets messed up, and it doesn't help that you fall off of ladders and stuff like that too, but it's all part of the gig. But no, you know, so far everything's been going really good, and I hope to keep it that way because I plan on doing a lot. So we got one more Tough Mudder this summer. Gonna start training for that, and that's if I can get 30 pounds off, which will also help elk hunting. Do a lot of elk hunting, so we do a lot of backpacking. But that's about it for me.
My turn, huh?
Your turn.
As she said, I'm Patrick, and I'm a caregiver for a person with Parkinson's, my wife. She's been with that for about 19 years now, we think. 15 years diagnosed, but before that, there were other things that we thought might be Parkinson's. The difficult part about being a caregiver is that you have to be aware all day, every day, of things going on. And when you're used to living with the person we've been together over 50 years, subtle things change, especially in the Parkinsons. And when you're used to the changes, you just don't see them until all of a sudden something is wrong. So being a caregiver isn't necessarily an easy thing in some cases. Fortunately, I don't have to give Julie her medicines because she's in pretty good control of her faculties most of the time. And but I do monitor, like she monitors me. Did you take your medicines today? And that kind of thing. As a caregiver, there's a lot of detail things you can do. One of the things we do, for example, is we make sure that her pill bottles don't have screw-on or child-proof caps so that she can get into her medicine without having a problem. We do other things like we'll buy, because of pricing, we'll buy large quantities of things like ketchup, and we put the ketchup in a small container that she can handle. It's just one of the things that you learn as time goes by, that you have to make it easier on that person who can't handle stuff because they shake or have no strength. She can still drive, fortunately, but there are times she has to drive me, but most of the time I do the driving. And I don't know what's going to happen in the future, but I think they're going to do things. The state has been saying they are going to do things about licensing health-wise. So that's one of the things that may come up. They're already doing some things for age. So that's something you want to be aware of. And, you know, if you're a caregiver, watch those rules because they will change. Medicines, she's been pretty stable on her medicines.
Only had one.
Yeah, fortunately for her, she only has one that has to do with Parkinson's. And it's pretty accurate. It works pretty well. But she has her on time and her off time, and I think those of you with Parkinson's know what that means. But there are other things that the caregiver has to do, and you just do them. You don't. It's just part of a responsibility, I guess, if you want to. But you know, it's pretty easy. I think I'm done.
Okay. I'm Julie. And like Patrick said, I've had Parkinson's for about 19 years. The first 3 years, I was diagnosed with chronic fatigue syndrome because they didn't know exactly what was wrong. I was having problems walking. That was my first sign. But you have to realize here, too, was that I grew up with my mother having multiple sclerosis, MS. So I thought maybe I had MS. I didn't. My mother went to Dr. Britt, so I knew Dr. Britt for a long time. And after I had problems, I started going to him, and all he asked me to do was just walk up and down the hall. And then, you know, when you go to the doctor, they have you do this test. Well, if you can see, you know, that my hand is not as steady as it used to be a few years ago. But that came a little bit later. I started going, Dr. Britt suggested that I go to the telehealth meeting, which I did. Patrick and I came to the telehealth meeting, and I learned quite a bit from that. But I also knew that Parkinson's and MS are very close to each other. So I wasn't too concerned like some people are totally afraid, scared. They don't understand what is going on with their body. But like I said, I grew up with my mother. I saw what happened to her and how she reacted to certain things. And this, with Parkinson's, you do the same thing. If you get too stressed, you shake. You can't walk right. That's one thing that I miss. is that I'd like to walk the way I used to walk. And I think most anyone that has Parkinson's notice that they don't walk the way they used to walk. You sort of shuffle, and you don't have your balance like you used to have. When I started going to the telehealth meeting, you always sit and you wonder, does she have Parkinson's or does he have Parkinson's? Because you really don't know. Because we're all sitting down. We're not walking, we're not writing, we're not usually talking because we're listening. The one time I thought I saw a lady that might have Parkinson's. So after the meeting, I talked to her, and she said yes. She and I decided that we would start a women's group, just strictly women that had Parkinson's. She was with me for about 6 months, and then her husband was transferred to Nevada because of his railroad job. So I have a ladies group called Women's with Parkinson's Disease, and it's strictly women's. You'd be surprised the difference between women and men that have Parkinson's. And I've already told my ladies, that there are a lot of things, the difference. Part of the thing is that we still fix our hair, we put our makeup on, we dress differently than men do. Usually men get out of the shower, dry off, comb their hair, shave, whether it's with an electric razor or a regular razor, and then they get their clothes on and they're ready to go. Well, us ladies, we take more time. We have to fix our hair. We have different undergarments. We have to put our makeup on, and we have to put earrings on. Well, I have a few earrings that I still like to wear, but Patrick has to help me with them because I shake. I can't get them on. But he's kind enough, and he says, sure, honey, I'll help you with your earrings, no problem. But with the ladies group, we do discuss quite a few things, including our medicines and our doctors. And it's a good support for women. I've had good response that if we didn't have that group, I think part of the women that do come wouldn't know what to expect. I do shake. I do have problems walking. I do take one medication. My doctor is very good about this because a lot of the other medications that they have out, I have Crohn's disease. Crohn's disease doesn't really like some of the Parkinson's medication. I also have super sensitive skin. And if I get the patch, even a Band-Aid will pull my skin off. So I cannot wear the patch. So like I said, there are lots of medications out there, but me personally, I can only take one. I take the carbidopa-levodopa, and I've taken that for a long time, and that agrees with me. So I think I've done my 5 minutes or so.
Sure.
I got so involved in listening that I forgot that I should probably come up and be ready to ask questions. Can I have the checkoff sheet too for the different locations? So everybody, thank you for your patience while you wait for me for just a moment. We're going to go ahead and start our question and answer session, and we're going to do like we normally do, where we're going to start with our first location. I'm going to ask you to tell us how many people are in attendance today, and then let us know if you have questions, and we'll go from there. So at this time, Anchorage, Alaska. Good afternoon, Anchorage. Are you there? If I end up going past you and you come back, just break in and let me know that you're there, okay? Billings, Montana.
I have a question. When you did your opening speech, you mentioned that you had the freeze for Parkinson's. How did you advertise or organize that, and what kind of a turnout did you have?
That's a very good question. It's the first time we're going to try it. It's our first annual. It's not happened yet. It happens on April 19th, and we contacted our local mall and asked them if we had permission to gather as many people there as possible. And I just researched flash mobs, and then there are actual freeze mobs, and researched those on the internet. And then we've been doing our advertising for that with our social media. We have our 4 Facebook sites, press releases out to all the media contacts in the area, and as much word of mouth as we can in all of our support groups and different activities that we have going on throughout the month. A postcard out. So I'm trying to hit it and our websites, trying to hit it on every venue that I can. And then I'll let you know next month how it went.
Thank you. I had another question. The gentleman who mentioned that he was using the Neuro Patch, and because he had so much outdoor activity and he was doing a lot of sweating and the patch wasn't effective. Are there different strengths of the patch? Did he try more than one, or what was the deal on that?
I tried them all. I think they went up to 8 milligrams, if I'm right. I don't know. You can also cut them in half to get to 4, and cut them in half again to get to 2. But it didn't really matter. The hotter it got, it was the strength or the dose that I was getting at the time. So a 2 milligram patch, I would still get sick. Just depending on the activity. And once that started happening, I pretty much gave up on it.
Brian, do you have feedback about, or do you know that off the top of your head as far as what the doses goes up to?
I can check that really quick to make sure.
And you don't have, if we get to any questions that are like that you want to make sure
Sure.
That's because an individual basis, let me know. Let us know, okay?
Sure.
Okay. And can I ask where you are out of? Are you from Anchorage or Billings?
We're from Billings.
Thank you. And how many people there today?
We just have 2.
Well, thank you very much for making it to telehealth, and have a safe journey home. We're going to move on to Sewell, Providence.
Anchorage.
Oh, Anchorage. Hello. How many there?
Two people.
Okay. And did you have any questions today?
Not right now.
Okay. Well, break back in if you think of a question, or add on to another one. We're going to jump to Sewell, Providence, St. Joseph's. Okay, Clarkston, Tri-State Memorial.
Yes, we're here. We have 19 people.
Welcome, Clarkston. Do
Okay,
you have
2
any
questions.
Okay.
Yes. Caregiver licensing. Now, I am the wife of a Parkinson patient. I'm the caregiver. So my question is, what did he mean about licensing? And my other question is this. The second man that spoke said he's trying to stay away from the hard stuff. What is the hard stuff?
Okay, you want to go ahead and start, Patrick?
There are all kinds of caregiving. When you work for a company that provides caregiving, then you have to be licensed, and you have to pass certain tests that have to do with first aid and patient care and things of that type. Myself, as a caregiver, it's a personal thing with my wife, and I'm not required to be licensed to do that. Does that answer your question?
You mentioned driving.
Oh.
There are certain things that I would need, to be a licensed driver and that kind of thing, if that's what you were concerned with.
Were you thinking of the caregiver part for licensing or the driving?
If you're speaking to Clarkston,
Yes.
I understand, of course, that a professional has to be licensed, but I just want to make clear on that, because I think most of us here are personal spouses. Thank you.
Yes, we agree. But the National Parkinson's Foundation, if you ever get a chance to go on their website, they have some amazing resources, and they actually do have a caregiver a caregiver class that you can take. And it's not a certification. It doesn't cost anything. You can download. And it's not about it. Most caregivers who are family caregivers are not licensed in any way, but that one's a really good one for support. So the National Parkinson's Foundation, you put in caregiver classes, so that's something that you might look into if you're interested. And then, Jared, did you want to answer the question about hard stuff?
Yeah, I guess hard stuff wasn't quite the right term. But I was thinking of carbidopa, levodopa. To me, that's the next step, and I want to delay the next step as long as I can.
That makes sense. Did you have any other questions, Clarkston?
I have another bit.
Oh, yeah.
Whatever you do, if you're a caregiver, find out any information you can get about being a caregiver, because there's a lot of things that we tend to do without thinking about it if you're a spouse. We just do things like we've always done. But if you go into caregiving classes and things of that type, they will teach you something new. Somebody always has a better idea.
When you mention carbidopa, that's my husband is on that and it works fine. I think this is the first time I've ever heard it referred to as hard stuff. Requip and all that other stuff I've heard about, and I'm just curious whether the pharmacist, percentage-wise, how many people take carbidopa? That's all.
Yeah, great question. And as I start too, I did check on the Neuro Patch, and 8 milligrams is the highest dose that's available.
Okay.
On that, with the carbidopa, levodopa, percentage-wise, I guess I'm not sure, how much, what's the percentage of people taking that, but what does change, and where we could talk about it being the hard stuff a little bit, is one thing with the levodopa, as some people take that over time, it is more likely to cause dyskinesias, and that's just one example. As some of you may know, Michael J. Fox is one. If you've seen him sometimes on TV, where he'll be moving a lot and rotating, and there's been some confusion about that because people have said, he's not doing well with his Parkinson's, but that's a levodopa side effect. And for someone like Jer, where it's a little different, is that the dyskinesias are more likely to happen with someone who's been on that for a longer period of time. And so sometimes if someone is diagnosed at a younger age, they'll often try to use something other than levodopa initially and save that for later, because that dyskinesia is more likely to happen than if that started earlier. What's interesting, though, along that line, and in terms of even percentages, it changes a little bit as someone ages. And I've heard sometimes, or somebody will say, well, kind of at 65, somebody's diagnosed more than 65, we might be more likely to use levodopa earlier. If it's younger than 65, we might try some of the other medications first. Now that can be a little bit arbitrary, but in general, as someone gets older, they seem to tolerate some of the dopamine agonists a little less. So as you mentioned, let's see, you were on, you tried 2 of them, right? So
yeah, I did the Nupro and
the Nupro
and the just straight Ropinirole.
The Ropinirole, and then on the XL.
Now the XL.
So we might try something like the Ropinirole first in a younger person, and then try to save the levodopa for later. But it's not uncommon then in someone, say 65 or even much older than that, if they're initially diagnosed, to start levodopa rather than one of the dopamine agonists. And that's just where the tolerability changes.
Thank you. Were there any more questions? Sorry, I just leaned into that. That was you. For Chair.
Question is, I noticed that you say some get Parkinson's at 31, and of course a lot of them get it a lot later in life. Does that mean the people who have it later in life had it at 31 and then didn't start having symptoms till later, or did they just develop it later?
I couldn't hear.
So I think if I understand her question and correct me, she was wondering if those who are diagnosed later on in life, when they're 65, like you were diagnosed at 31, if they've had it back as far as in their 30s and they just didn't know it. Did I paraphrase that right?
Yeah, that's right, isn't it?
That's right.
Yeah. And so as you've been diagnosed, has anything ever come up about how yours just manifested early, but maybe you wouldn't have seen those until later on, or have you had any experiences with that?
Not really. I guess I never really thought about it. I guess once it hit, I just dealt with it, and then it was what it was. And
well, here's another question that I'll add on to that. When you were 31, when your hand started to shake, do you, as you look back now, think that you had any symptoms before you were 31?
I never thought so. I always have muscle pain and stuff, but we were always active doing different things. And a coworker actually, when I was diagnosed, he went to med school, and he was a doctor for a while and decided he wanted to be a bricklayer. Just a little side note. I don't know. I call him the fool. But he said he would notice, especially when I was driving our dump truck, I would get jittery.
Okay.
But I never noticed.
Okay.
So.
Did you have any more questions, Cordeline?
No, I don't think so.
No, thank you. I don't.
I do have one question. Can't think of her name. The lady that has Parkinson's, at what age was she diagnosed?
Julie?
I was 49.
What, 45?
49.
49.
Thank you.
Okay, let's go to Colfax Whitman Hospital. If I skip you and you are there, just chime in a little bit, okay? Colville, Providence, Mount Carmel.
There are 5 of us here.
Welcome. I hope you didn't get too much snow yet. Last night I heard something about snow up there. Did you have any questions today?
No.
No questions.
Well, thank you for your attendance. Let us know if you do have any questions. Dayton General Hospital. Grand Coulee Medical Center. Grangeville, Idaho, Syringa Hospital and Clinics. Kennewick General Hospital. I'm sorry, am I the only one that thinks about soap operas as I say that? The General Hospital, every time I'm saying that, I expect the General Hospital show. It's not on anymore unless you have the internet. Sorry about that, guys. Kirkland Evergreen Healthcare.
Hi, there's 5 of us here. We don't have any questions, but if I could just take a second and introduce myself. My name is Steve Wright. I'm the new executive director of the Northwest Parkinson's Foundation. Cindy, it's nice to see your face after speaking with you on the phone. Hi.
Nice to meet you, Steve. Thank you.
Nice to meet you. And I also, one quick plug, on Saturday, May 4th, we will be having our 4th annual wellness conference, and that will be in Everett, and everybody is definitely invited to that conference.
And Steve, I would ask if there's a way to get an email. I will put that on our websites and in our Facebook. If I can get an email flyer for that, we would love to do that.
You got it. Thanks, Cindy.
Thank you very much. Miles City, Montana.
Montana, we're having a snowstorm here. I doubt that Miles City showed up. This is Billings.
Oh, thank you very much. And I'm sorry you're having a snowstorm. I hope it's one of those quick spring ones where it disappears pretty quick. Thank you for letting me know. Moses Lake, Samaritan Healthcare.
Thank you for the presentation, all participants. I've got one observation or question. Are you hearing me?
Yes, we can hear you.
Okay. For Brian, my wife sitting next to me here has had Parkinson's for 36 years. Diagnosed in 1977. She was just barely 33. So she's had quite an evolution of drug therapy. And recently, with the advent of computer word processor, I've maintained a personal history, which has really been helpful in the series of and numerous medical appointments we have. Instead of just canceling out the previous one, I've continued to save as and go to it. So I've got maybe 30 or 40 updates, which has been helpful as we go back. We're changing neurologists now, and you have to give a history. And you mentioned history as one of the issues that you say patients should be aware of. One, you said update, have an updated med schedule, dosage schedule, be able to describe effects, side effects, and so forth. But by the history, are you talking about what I'm explaining here, and that's cause and effect, different meds, different levels, and some history of that? That's, you know what I'm asking or saying there?
I do, and yes, that's exactly what I was referring to, and that's excellent if somebody has that, and if they're asking us questions about medications and which ones might be a possibility, the more history we have is really helpful, and absolutely with what's happened with the medications, and you know, I didn't mention it with the changes, so I'm glad you brought that up. Because at times when someone does have a full history like that, and not only what's happened with medications, say from a side effect or allergy standpoint, but also what has been tried and what helped and what didn't. And even when something was started, that can make a huge difference if we're looking at side effects, or if somebody's asking us, can we use a different medicine? The more we have about what all has happened, the better. And same way with even going in exactly to a new physician as well. The more information you have, I think that's even better. And that's exactly what, if you can do that, that's perfect.
Well, I was just going to say it saved us a lot of time.
Yeah.
As you sit in a medical office and you spend a half hour rewriting everything, you've got it out there in a script. And I'm no computer guru by any stretch of the imagination, but it's certainly been helpful for us in dealing with the repeated requests of this information. So I just mention it for the benefit of others.
Yeah, and I think that's great. And if someone is able to use a word processor, I think that's, or the computer, and have it saved, that's a wonderful way to do it.
Thank you.
Thank you very much.
There's, we have five members here today. Yes.
Okay, thank you very much for attending and your comment today.
Thank you.
OMAC Mid-Valley Hospital. Sewell Community Hospital. Pendleton, Oregon.
We have 3, and our dog is back, and we do have a something he wants to say. Not the dog.
Oh, well, we could try to answer that one too.
Okay. Oh, do I have to put it?
Go ahead with your question when you're ready.
Okay, I feel for you on the ladder thing. I had a ladder last year. They took them away from me now. I fell 23 feet, broke my back and my arm. So.
Thank God I was only 4 feet.
I fell that much several times when I was working.
That just shows how good an old fart can land.
Yeah. I do have one more thing. The pharmacist, do you agree that the patient should have some leeway to experiment with their meds? Like myself, I go through the Veterans Administration. They seem to supply me very well with medications, sometimes refilling early, and I experimented they had me on 3. I slowly built up to where I was on 6. When I went to see the neurologist, he told me, you know, if I didn't know better, I would say you didn't have Parkinson's because the meds were working. And so that's what he prescribed for me then.
Mm-hmm. That's a great question, and I think probably I have to be careful when I say it's a good idea to experiment with your medications, but on the other hand, I think really Parkinson's is something that if someone, either the person with Parkinson's or a caregiver, does understand the medications well, we definitely see times when prescribers will give them some leeway in that to try to adjust for their symptoms. And that it is, you do have to make sure someone understands really well what they're looking for, both in terms of when the med is helping and what side effects to watch for. But we do see it a lot sometimes with some of the wearing off and even the on-off issues, where at times some of the physicians especially will use the levodopa, carbidopa immediate release and allow for some adjustment of that, and then get some feedback too. If someone's doing that, that is a really important time to get that history so that there is a good recording there of what happened when that was taken, because if it can be very hard then if someone did end up taking a lot to have some issues there too, because we have run into times when maybe someone took too much and even got some of the more severe side effects and maybe overdid it, of course. But I think at certain times that can be very appropriate. Did that make sense?
Yes. See, I'm on ropinirole myself.
Okay.
And I'm right now just at 6 milligrams a day.
Okay.
2 milligrams 3 times a day, and I believe 24 milligrams is about the max they prescribe for that. I've done a lot. I do a lot of internet research, and at times I've even talking to the people who did the original experiments, and so to get
as a maybe a legal and medical disclaimer, you should always talk to your neurologist and your doctor about these things, and we're not here to give advice, but we're happy that you asked that question, because everybody is individual for how their medications work. So thank you, and we're glad that you have found some ways to make that work for you. Let's see, was there any more questions in Pendleton?
We're good.
Thank you. Give that dog a pat on his head, okay? Port Townsend, Jefferson Healthcare. Pullman Regional Hospital.
We have 2 present and no questions.
Thank you for attending today. Ritzville, East Adams Rural Hospital. And Spokane. Did we have any questions here today?
We have 34 in attendance.
Thank you for counting, because I had not counted. I appreciate that.
I have a question. What I want to ask is, are any of the patients here are they falling? My husband falls a lot from his Parkinson.
Okay, just in case you couldn't hear that at the other sites, the question was for the Parkinson's patients that are here, if they notice that they fall more or a lot.
I can answer that for my wife. She does have balance problems. She was diagnosed with Parkinson's about 6 years ago. Also, as far as having symptoms before that, many folks with Parkinson's, one of the earliest symptoms that's noted before they realize they have Parkinson's is impaired ability to smell. They can't detect odors. And in my wife's case, that happened. We noticed that she was losing her sense of smell at least 15 to 20 years before she was diagnosed. No other symptoms at that stage, but about 10 years before she was diagnosed, 10 years, she was having balance problems, and she did fall and break her hip. And after the Parkinson's was progressed, her balance and stability problems have increased, and she is falling more frequently. Falling is very common in old folks without Parkinson's, and folks with Parkinson's have an even greater problem because of their balance problems. So yes, that's very common.
And Julie or Jer, have you noticed in your personal experiences more falling or just more gait issues, or what have you noticed?
Well, early on for me, I was having a lot of rigid muscle in the piriformis muscle in the hip that controls your hip. My knee started hurting, and I was having a heck of a time walking, and so I went into the chiropractor. I don't know what's going on. He lays me down. One foot's like this and one sitting up. And so he dug his knuckle right into my rear there, and that foot went whoop, and he let go and it dropped. Yeah, I was walking with one foot sideways. Never even noticed. And which, I was using a 4-foot level. We were putting in septics at a time going up and down a hill, and I was falling and using this level as a cane, and because it's not going to affect me, but lately I've noticed more falling, like the ladder, like 2 days before we left for Hawaii. That one, luckily my head broke my fall. And yeah, I went a week this winter where I fell once every day, once off a haystack, once trying to chase cows, and it was really starting to get frustrating. And so I had to stop and just figure out where I'm going and not just go like I used to.
And Julie?
I fell once, but it wasn't because of Parkinson's. It's because of the store. It was during wintertime, and their carpet, when you go into the store, it was ruffled up, and I didn't see it. And I did not pick my feet up like doctors tell you you're supposed to pick your feet up and watch where you're going. But no, I haven't fallen, but that was the only.
She's come close many times because she does have the Parkinson shuffle, and the feet aren't picked up. So if there's something there like a carpet or a door jamb, feet will catch on it. Sorry to interrupt here.
Any other questions?
My husband is when he's standing holding his walker, his legs start really shaking, and then he just automatically goes down. Now he's been diagnosed 10 years now, but he's 80 years old, and so his is getting progressively worse.
It's kind of a new one for me. It's been recent, and it's weird because a lot of things you can kind of pinpoint, okay, this is what I did wrong, whereas now it's what happened. I was upright, now I'm down. And I don't even know, we at one point we were carrying, it was about a 300-pound door, and I just went down, and it was under my arm, and my father-in-law is holding the other end and said, get your arm out from under there. I'm sitting there going, I can't, and I don't even know why I went down. And so that's starting to get a little frustrating, but is what it is.
Okay, I have a couple of questions.
Okay.
Jeremy, you mentioned the massage.
Yes.
Is there a particular body part, or is this whole body? Is the person you're going to...
You're paying for it, get the whole shooting match.
Are they trained to work with folks with Parkinson's, do you know? Or?
Well, I think most massage therapists, they're as they're going, they're feeling the muscle. They know where, immediately where you're going to need. And they watch you walking in. They'll know what they need to work on more. And with me, I get a lot of knotted up muscle, especially in my shoulders and my neck. And, they can feel those.
And for Brian, you mentioned making home visits and going over folks' medications with them. And many folks with Parkinson's have other problems besides. And when you do this, well, first of all, how does somebody get a hold of somebody like you to make a home visit to go over their medications?
We do that directly through, we're based with the Providence visiting nurses here in Spokane, and that's, we have a direct relationship with the college and the visiting nurses, and so we do it for people who are actually patients of the visiting nurses themselves, and those are people requiring home care in some way, so that they're considered to be homebound in the sense they can't get out by themselves. And so that has to be on a physician's referral to be seeing the agency. And then once the physician has referred them to the agency, they can ask us to come out and do that.
Okay, and then is that something covered by Medicare?
At this point, there's not a charge for us to go out. So it's a combined educational service type activity at this point. So there's no charge for them whatsoever.
Okay, thank you.
And Jay had a question.
This is a pharmacy question too. I'm aware that there's a big differential in what we pay for prescription medications depending on where we're going, and I'm wondering whether pharmacists themselves have anything to do with these differences, or if you have opinions about it. It's a real serious problem.
Sure.
And involves getting on the phone and calling and comparing, and it's kind of a pain.
It is. There can be a lot of factors, I will say there. So most of the pharmacies themselves aren't directly setting a lot of the prices. Sometimes, depending on where someone goes, there might be more leverage that the pharmacist might have in some cases to be able to price match or something like that. Depending on especially some of the more expensive meds, interestingly enough, at least from most cases, the pharmacies actually probably have less of a margin that they would say on some of the brand names than they might on some generics sometimes. But so, and especially once, obviously you're probably referring to someone without insurance, but when insurance is involved, there's a contract price for that. So the pharmacy doesn't get to set anything, and they have to charge you what the insurance contract is. When it's a cash paying customer, sometimes there's some variation there. So I will clarify that. But if it's insurance, in most cases you won't pay anything different. So even say with Medicare Part D, if someone does have that, the pharmacy has to charge you the price that the insurance is set. That's part of the agreement. So does that help a little bit?
Thank you. Let's see, Tenasket North Valley Hospital. The only thing really bad about me looking at that screen is I get to see myself down there in the corner when I do it. That's just not very fun. Tenasket North Valley Hospital. Walla Walla, Providence, St. Mary's Medical Center.
We have 3 today, and I have a question.
Yes, please, go ahead and ask. We're ready for the question when you are. Thank you for being there today. Walla Walla, can you hear us?
Hello?
Hi there.
Are you there?
There we go. Now we can hear you.
The last couple of 3 months, I've had trouble with dizziness, and one time I passed out completely. I've had tests on my neck, my heart, my ears, and the vertigo, but I'm still having dizzy spells. Is that ever a side effect for anyone else from Parkinson's?
It was for me with the Neuro Patch. That's when my blood pressure would drop really rapidly. I'd get dizzy and pass out.
And I thought I saw Julie shake her head that it's not something you deal with.
No.
And I'll just throw in, from the medication standpoint, is Jeremy brought up the medications can do that. And one thing with it's not always directly the medications, but we do worry about the blood pressure at times, and some of that is even just it's part of Parkinson's too, with the blood pressure changes, and some people with Parkinson's, especially if they've had it over time, will have trouble with blood pressure, so they may even be at the point where they're not taking any blood pressure medications or even on medications to help increase the blood pressure. And that's both because of the Parkinson's and sometimes the medications too. So you kind of get a double whammy. Parkinson's will lower the blood pressure, and the medications to treat it can often do that as well. And so that's just, and you may have had that evaluated, I know, but I'll say from my experience, we still see some people with Parkinson's who had high blood pressure at one point and even end up remaining on their blood pressure medications when they're at the point where they should probably be completely off those because they're having low blood pressure. So that, if that hasn't been evaluated, that's one thing that might help.
Thank you. Any more questions, Walla Walla?
No, that's all.
Thank you. Newport, Washington. Or Idaho. Newport. Old towns in Idaho, right?
Yeah.
Okay, sorry about that. Learning my geography. Newport, are you there? Okay, if there's no more questions, I would really like to thank our panel today very much. And I know if Jackie was in the room, even if you've already gotten one of the Parkies, well, sorry about that. Thank you very much.
Thank you.
For joining us during Parkinson's Awareness Month.
We all
There's a lot going on in April for Parkinson's Awareness Month here in Spokane, and our goal is to try and help provide as many resources for those affected by Parkinson's in the Spokane area, in the Northwest, and all the areas that we provide this service to with the telehealth. And Parkinson's is not just those with Parkinson's. It's you, it's me, it's wives, it's husbands, children, family, friends, and providers. So thank you for all that you do, and let me know if there's anything I can do for you. And there's a calendar outside as you go. But thank you very much for coming, and we'll see you in May. Right now, the topic is tools to help stay in your home longer. So, thank you.
Thank you.
Thank you.